right, ladies, this is what I've been talking about all for the last 2 hours about or so. So if you knew your risk of breast cancer, what would you do with that information? What tests would be available to you? What things would you maybe do differently? Well, as you know, it is a topic that hits close to home for me, and I'm joined right now by Molly Gamusio. She is a certified nurse practitioner at the Cleveland Clinic who helps patients with their breast cancer risk assessment every single day. She is who I went to, and I will never forget the phone call afterwards with her saying, I really didn't think this was going to be the news I wanted to tell you, Natalie. I thank you for coming in today.
Very welcome.
And I know we're going to help save lives right now. So the risk assessment, a lot of people, when I said, get your risk assessment, people said to me, I don't know what that is. How do I get it? Where do I go? So what is a risk assessment, first of all?
So the breast cancer risk assessment is a tool that is going to calculate your risk for developing breast cancer over a lifetime. We know that breast cancer is going to affect 1 in 8 women, or 12% of women, during their lifetime.
And who should be looking to get a risk assessment? What are some of the things that we should be looking out for?
So anybody who has a family history of breast cancer, maybe in an immediate family member or multiple family members, should definitely think about getting a risk assessment. Someone who's had a breast biopsy, depending on those results, should get a risk assessment done by us as well. Depending on your age, if you know that you have a genetic mutation or there's a family genetic mutation that you're aware of.
Breast density is also on this list.
Correct.
That is what was an issue for me. And I know when I had a previous mammogram, I had seen on the results that it said that I had dense tissue, but I had never been told maybe that that's something that I should be looking into further as far as making sure that, because why does breast density have a factor in this?
So breast density, when we look at that on mammogram, it can obscure other things that can be found on your mammogram. So the more dense your breast tissue is can make it a little bit more difficult to read. So that's why it's important to know your breast density, and that's why it's included in all your mammogram results now.
So when someone comes into your office, and they get the, I mean, it's very simple. It's on our end as a patient, it's a simple process, right? What all are you looking at when someone comes into your office?
So we're looking at your current age. We're looking at your menstrual history. How old were you when you began having menstrual cycles? How old were you when you stopped having them and you're now postmenopausal? We look at your childbirth history. Have you ever been pregnant? What age was your first child born at? We look at, again, breast biopsy results. We look at breast density. If you've had any hormonal contraception or replacement therapies, how long have you been on those? We also look at family history.
And all of this factors into a number that's then given, which is what we had asked you to do, because you can do this at home as well. And we showed you the GALE, I believe the GALE model, and that's what was the website that we asked you to go to. What is the number that is the cutoff to where we say, okay, they're high risk now and maybe more tests need to be done?
There's certain models. There's many different models, so it depends. We use something called the IBIS or Tyrer-Cuzick model. We use the GALE model as well, but typically with the Tyrer-Cuzick model, anything over 20%, someone is considered high risk.
So if you took this test at home and you realized that through that you were 20%. Now, you said the GALE model might show lower numbers.
A different percentage,
A different percentage. So it's still good to go in. Again,
Correct.
It is so simple to have this done.
Yes.
But if they're 20% or above, which I was at 21 point something, we have another employee here that I work with who just told me she did it, and she was at 24%. What happens then once you find out you're high risk?
Once you find that out, it can be very scary. So we want you to come in. We will probably repeat a model risk assessment as well, but we might talk about, further recommendations for breast screenings, maybe including breast MRI. We might defer you or refer you to a genetic counselor to see if there's any high risk for a genetic mutation. We might talk about risk-reducing medications or even preventive surgery.
How can they get to you if they've done it at home and they want to do, even if you didn't take it, you can go to these experts. So does it require a doctor's referral for someone to come and see you?
With some insurances, they may recommend a referral, but otherwise you can call us at our breast center.
And the breast center's in Fairview?
Fairview, we have them at main campus at Cleveland Clinic, Strongsville, Avon,
and on the east side. There were that many locations for this.
Beechwood.
So if someone has their annual gynecology appointment and what would they say to their doctor if they're hearing this today and they say, you know what, I want to get a risk assessment and my doctor never kind of told me I could do that?
So just talk to your primary care doctor or your gynecologist, whomever you're seeing, and just say, I have this family history. Would it be a good idea if I came in and got a risk assessment? Can you refer me to the breast center?
And any parting words from you? I mean, I know, ask as many questions as you can. Educate yourself as much as you
Correct.
can. I mean, I feel like there's so many things that as women we don't know to ask, and so this I feel like is helpful. We just saw Olivia Munn, actress Olivia Munn, go through the same
Right.
thing.
Right.
She found out, thankfully, early on because of a risk assessment as well.
Right, right. So, be aware of your body, be aware of your health. Lifestyle modifications that you can help are, diet, exercise, having a healthy BMI, doing your monthly self-breast exams, making sure that you're getting a clinical breast exam every year, and starting your yearly screening mammograms at 40.
And ask. I know I'm a huge proponent of if they can through insurance get an MRI done after they've had the risk assessment, do it, in my opinion.
Yeah.
That absolutely, because Olivia Munn was also saying she had a mammogram, and while they're good for certain things like
Right.
calcifications,
Right.
the MRIs are helpful in other areas too.
Correct.
And that caught something that her mammogram didn't catch. So to be able to do both, one every 6 months,
Correct. Alternating.
can save your life.
Yes, it can.
I thank you so much.
Aw.
She has been such a joy. She's checked in on me through this whole process, and I couldn't have gone through this without you helping me through those
Aw.
first very crucial steps. So thank you.
You're so welcome.
Thank you for sharing this with all of us today.
Absolutely.
Again, there is the website to go to if you want to go do this at home right now. And if not, talk with your doctor, get a risk assessment done through the Cleveland Clinic, and make your life or maybe someone else's life better because of this. So it's just so important that we take care of ourselves.
Yes.
Thank you so much.
Thank you so much for having me on.
It is my pleasure to have you
Appreciate
here
it.
today.